Inside the 2024 VHA State of Innovation Report, a deep dive into transforming veteran healthcare. Welcome to TVC, the Veteran Channel. Please subscribe and leave a comment if you want any topics covered, and we will make a video for you and reply to the comment with a link to the video topic you needed covered. Alright, back to the video. The 2024 Veterans Health Administration State of Innovation Report provides a sweeping overview of the VHA's efforts to address evolving challenges in veteran healthcare. It highlights cutting-edge innovations, major program milestones, and new policies designed to provide more effective and compassionate care. VHA, America's largest integrated healthcare system, 9 million enrolled veterans, report pages. The VHA stands as the largest integrated healthcare system in the United States, serving over 9 million veterans. The comprehensive report spans 84 pages, showcasing the VA's success in various areas. With over 9 million veterans enrolled, the VHA stands as the largest integrated healthcare system in the United States. Its mission is not just about providing healthcare, it's about enhancing the quality of life for veterans, their families, and caregivers. This report, spanning 84 pages, showcases the VA's success in areas like expanding access to care, integrating advanced technology, fostering community partnerships, and improving outcomes for veterans across the board. Let's dive deep into each section to understand how the VA is transforming the landscape of veteran care, revolutionizing access to care. One of the most pressing challenges for the VA is ensuring that all veterans, regardless of location, have timely access to high-quality healthcare services. Digital health expansion. The VA has heavily invested in digital health solutions to bridge the gap for veterans living in rural and underserved areas. Virtual care growth. The report notes a 300% increase in virtual care services. Remote patient monitoring. Over 500,000 veterans are actively monitored for chronic conditions. Tech-enabled respite home care pilot. This innovative program allows veterans to designate trusted family members as caregivers, while providing those caregivers with professional training and competitive pay. Same-day physical therapy. Veterans no longer need to wait weeks for physical therapy appointments. Pilot sites report a 40% reduction in pain-related emergency room visits and faster recovery times. Virtual care growth. 300% increase in virtual care services. Veterans now use telehealth platforms to consult with doctors, receive mental health support, and manage chronic conditions without traveling long distances. Reduced travel burden. Virtual care eliminates the need for veterans to travel long distances for routine consultations and follow-ups. Improved access to specialists. Veterans in rural areas can now connect with specialized healthcare providers who may not be available locally. Remote patient monitoring. Heart disease. Continuous monitoring of cardiovascular health for at-risk veterans. Diabetes. Real-time glucose monitoring and management for diabetic veterans. Hypertension. Regular blood pressure checks and medication management. Over 500,000 veterans are actively monitored for chronic conditions like hypertension, diabetes, and heart disease. This has reduced emergency visits by 25% and increased patient satisfaction. Tech-enabled respite home care pilot. Family caregiver support. Caregivers earn above-average wages and receive resources like respite care to avoid burnout. Professional training. Family members receive comprehensive training to provide high-quality care. Rural impact. The program is particularly impactful in regions with limited access to professional home care services. Same-day physical therapy. Immediate access. Veterans no longer need to wait weeks for physical therapy appointments. Integrated care. Embedded physical therapists within primary care teams have reduced musculoskeletal treatment delays. Improved outcomes. Pilot sites report a 40% reduction in pain-related emergency room visits and faster recovery times. Suicide prevention and mental health resilience. The VA has made suicide prevention its top priority, addressing a crisis that claims the lives of 17 veterans per day. Mission Daybreak, a $20 million initiative. This challenge funds innovative projects aimed at reducing veteran suicide rates. Veteran socials. Weekly social gatherings are now hosted at over 100 locations nationwide. Personalized Lockbox Initiative. Combining mental health support with practical tools, this program promotes firearm safety to reduce the risk of suicide. Mission Daybreak, $20 million for suicide prevention. AI-driven crisis intervention. Community-based peer support. Winning solutions include AI-driven crisis intervention systems that identify veterans at risk through behavioral patterns. One funded program leverages community-based peer support to connect isolated veterans with local resources. Innovative approaches. The initiative encourages out-of-the-box thinking to address the complex issue of veteran suicide. Veteran socials, building connections, 100 plus 70% locations. Weekly social gatherings are now hosted at over 100 locations nationwide. Reduction in loneliness. Surveys indicate a 70% reduction in feelings of loneliness among participants. These events build strong support networks among veterans, leading to measurable improvements in mood and quality of life. Personalized lockbox initiative. Safety first. Veterans receive lockboxes equipped with safety features and educational materials about crisis prevention. Wide reach. The initiative has reached 15,000 veterans and their families, with plans to expand nationwide. Comprehensive approach. Combines mental health support with practical tools to reduce the risk of suicide. Advanced manufacturing and technology integration. The VA's use of advanced technology is reshaping veteran care. 3D printing solutions. The Virginia is a leader in advanced manufacturing, with 50 facilities equipped with 3D printing labs. Custom prosthetics. Veterans with amputations receive personalized prosthetics designed for their unique needs. Medical models. 3D printed surgical models improve precision and outcomes in complex procedures. SimLEARN. Simulation-based learning. Simulation-based training ensures VA healthcare providers are prepared for any situation. Training covers areas like emergency care, surgical techniques, and diagnostic skills. Virginia facilities using SimLEARN report a 20% decrease in procedural errors and faster response times during emergencies. 3D printing solutions in VA healthcare. Custom prosthetics. Personalized prosthetics designed for each veteran's unique needs. Medical models. 3D printed surgical models for improved precision in complex procedures. 50 equipped facilities. VA facilities across the country with advanced 3D printing capabilities. SimLEARN, enhancing healthcare through simulation. 20% decrease in procedural errors. Enhanced emergency response. Faster response times during emergencies. Comprehensive training. Emergency care, surgical techniques, diagnostic skills. State-of-the-art simulation. Realistic scenarios for hands-on learning. Chronic disease management and prevention. Managing chronic illnesses like diabetes and heart disease remains a cornerstone of the VA's efforts. Diabetes self-management education and support. This program equips veterans with the tools they need to take control of their health. Veterans using continuous glucose monitors experienced a 30% reduction in diabetes complications. Group education sessions have increased adherence to treatment plans by 40%. Whole health initiatives. The VA integrates traditional medical care with wellness practices. Programs like yoga, meditation, and nutrition counseling are tailored to individual veterans. Veterans participating in whole health programs report a 25% reduction in hospitalizations for cardiovascular issues. Diabetes self-management education and support. 30% reduction in complications. Veterans using continuous glucose monitors experienced a 30% reduction in diabetes complications. 40% increased adherence. Group education sessions have increased adherence to treatment plans by 40%. This program equips veterans with the tools they need to take control of their health, leading to significant improvements in diabetes management and overall well-being. Whole health initiatives. Yoga. Tailored yoga programs for veterans of all abilities. Meditation. Guided meditation sessions for stress reduction and mental health. Nutrition counseling. Personalized dietary guidance for optimal health. The VA integrates traditional medical care with wellness practices. Veterans participating in whole health programs report a 25% reduction in hospitalizations for cardiovascular issues. Addressing veteran homelessness. Homelessness remains a critical issue, but the VA is making significant strides in providing support. Grant and Per Diem Program. This program funds emergency housing, transitional shelters, and essential supplies for homeless veterans. Recent expansions allow grantees to provide items like hygiene kits, food, and winter clothing. Telehealth access for homeless veterans. The VA recognizes the importance of continuity in healthcare for homeless populations. Grants help shelters set up telehealth stations, enabling veterans to consult with healthcare providers without needing a permanent address. Grant and Per Diem Program. Emergency housing, transitional shelters, funding for immediate shelter needs of homeless veterans. Support for facilities helping veterans move towards permanent housing. Essential supplies, provision of hygiene kits, food, and winter clothing to meet basic needs. Telehealth access for homeless veterans. Shelter telehealth stations. Grants help shelters set up telehealth stations for veterans. Healthcare continuity. Veterans can consult with healthcare providers without a permanent address. Improved access. Reduces barriers to healthcare for homeless veteran populations. Community collaborations and cultural competency. Cultural awareness and collaboration are key to meeting the diverse needs of veterans. Hero Story Program. This initiative addresses the unique needs of American Indian and Alaska Native veterans. Traditional healing practices, such as talking circles and ceremonial treatments, are incorporated into mental health services. Veterans in these programs report a 50% improvement in cultural satisfaction with care. Public-private partnerships. The VA works with private companies, nonprofits, and other federal agencies to scale impactful programs. These partnerships have been instrumental in expanding programs like Terham and Mission Daybreak. Heroes Story Program 50%. Improved satisfaction. Veterans in these programs report a 50% improvement in cultural satisfaction with care. Traditional healing practices. Talking circles and ceremonial treatments are incorporated into mental health services. Cultural competency. Healthcare providers receive training in Native American and Alaska Native cultural practices and beliefs. Holistic approach. Combines Western medicine with traditional healing methods for comprehensive care. Public-private partnerships. Collaborative efforts. Virginia works with private companies, nonprofits, and other federal agencies. Scaling programs. Partnerships help expand successful initiatives like Terham and Mission Daybreak. Innovative solutions. Combining resources and expertise to develop new approaches to veteran care. Workforce development and accountability. The VA is committed to building a skilled and ethical workforce. Training programs for VA employees. New staff receive comprehensive training on best practices, whistleblowing, and patient safety protocols. Accountability measures. Annual reviews and inspections ensure all VA facilities maintain high standards of care and security. Training programs for VA employees. 1. Comprehensive instruction on the latest healthcare techniques and VA procedures. 2. Whistleblowing education. Employees are trained on the importance of reporting unethical behavior and the protections available to whistleblowers. Rigorous training on maintaining patient safety and preventing medical errors. Accountability measures. Annual reviews. Regular performance evaluations for all VA staff members. Facility inspections. Thorough inspections of VA facilities to ensure compliance with standards. Continuous improvement. Implementing feedback and lessons learned to enhance care quality. Key impact metrics. 9,500,000 veterans served. Remote monitoring. Over 9 million veterans served annually. 500,000 veterans enrolled in remote monitoring programs. 1,030,000. Suicide prevention. Homeless support. Suicide prevention programs reached 1 million veterans, saving lives. Homeless veteran support programs expanded to serve 30,000 veterans nationwide. 3D printing innovations. Conclusion. Innovative care. The 2024 VHA State of Innovation Report showcases cutting-edge approaches to veteran healthcare. Community focus. Fostering community partnerships and cultural competency to meet diverse veteran needs. Technological advancements. Leveraging technology to improve access and quality of care for veterans. Holistic approach. Focusing on holistic care to enhance the overall quality of life for veterans and their families. The 2024 VHA State of Innovation Report is a testament to the VA's dedication to improving veterans' lives. By leveraging technology, fostering community partnerships, and focusing on holistic care, the VA is setting new standards in healthcare delivery. Support TVC and veterans. Subscribe to TVC. Stay updated with the latest veteran-related news and information. Check out our merchandise. Funny veteran-themed products like mugs and clothing available. Spread the word. Share our content to help more veterans access valuable information. If you want to support TVC and other veterans, please subscribe and check out our merchandise of funny veteran-themed products like mugs and clothing. Thank you for watching. Please subscribe,